When you finally have a diagnosis of an autoimmune disorder, you're in organ damage or tissue damage at that point. And so autoimmune disease is on a spectrum, and we're going to try to have you understand the magnitude of how the spectrum works and why it's important to try to get to the underlying causative factors of why we get organ damage, why we get tissue damage. And we're going to get a lot into that as we go along. So there's about 50 million Americans that have autoimmune, and I'm going to define autoimmune a little bit different than the CDC does. I'll show you in a few slides how that is. They say 1 in 5. Most of them don't know they have it. And so if you've already been diagnosed with an autoimmune disease, you're in what we call sort of active organ damage. It's going to double in the next 20 years. When I first started my functional medicine practice, my primary autoimmune patient was pretty rare. That was 27 years ago. Now my primary patient is autoimmune, and it's between the ages of 15 and 25. And I'm going to repeat that. An autoimmune disorder is usually, in the past, had been in our 40s and 50s. As our immune systems got weaker, we got exposed to more toxins and such. This disease was an older, like I'm 52, I wouldn't say that's old, but as you're aging, the immune system starts getting more compromised. So most autoimmune things, when I first was out in practice, were 40, 50, 60-year-olds, not teenagers and 20-year-olds. My primary autoimmune patient right now is in their teens and early 20s. And I'm going to tell you why. It's the fastest growing epidemic for healthcare because pretty much all diseases fit into autoimmune disease. What is an autoimmune disease? An autoimmune disorder refers to a condition where the immune system starts attacking your own healthy tissues. And so the immune system has gone awry, and it starts looking at your tissue like it's a foreign invader, and it starts attacking it. Okay? These antibodies are supposed to protect us from the outside world. Viruses, bacteria, things like that that come in when you're sick, you're supposed to be attacking those things as they come in. And so what happens over time, and I'll explain how this has gone wrong and why our bodies now are attacking our tissues. These antibodies are supposed to be protecting us, not attacking our tissues. As I said when I first started, autoimmune disease is on a spectrum. You know, everybody talks about the autistic spectrum. Well, this is a spectrum, okay? It takes decades to develop the disease and the diagnosis. If you've got the diagnosis, you've had this for at least 10 years. There is no question about it. It develops slowly over time. I'll show you some slides that'll kind of give you that picture inside your brain. You have to understand the big picture of functional medicine and the underlying causative factors of immune function and how it develops, or you will never arrest the disease process. You will continue to develop on and on. If you have one autoimmune disease, okay, you have Hashimoto's, you have psoriasis, you have MS, whatever, you are more likely to get 2 to 3 autoimmune diseases all in one. You start out with cellular damage. So you start, and I'm going to get into the physiology of this a little bit more, but it starts out with cells being damaged, okay, and then it moves into tissue damage. So you might have a muscle cell that starts getting damaged initially, or a joint, your joint cell. We'll talk about RA. And then eventually the cartilage inside the joint gets destroyed. It starts destroying the bone. That's when we get tissue. Then all of a sudden the organ, which is the joint in RA, the organ starts getting degenerated and it develops arthritis. So that's what we call organ damage. When we talk about MS, we're talking about the nerve and the myelin sheath and such. And then you get inflammation, you get organ damage, and it isn't until you get down here to the organ damage that you actually get symptoms. So you go through this entire process before you actually get a symptom and it's diagnosable. So you've gone through this whole stage and phases long before you get a diagnosis. And we want to get you when you're up in this area, up in here, not when you're finally diagnosed with this. And autoimmune disease is very difficult to diagnose. Very, very difficult.